Weight gain. It's the main complaint that I've been hearing repeatedly from patients during this COVID-19 quarantine. Sure, we have more time to eat, snack, and sit around more than ever before, and that might have something to do with it, but you don't want to miss these 8 other surprising and often missed medical causes of weight gain. So stay tuned. If it's your first time here, I'm Dr. Majd. Make sure to subscribe to this channel for up-to-date medical topics and headlines. All right, here we go. Number 1, thyroid disorder. The thyroid gland is a small gland that sits in front of your neck, but don't let its size fool you because it helps to regulate almost everything, including your metabolism. So people with untreated hypothyroidism, which means that they just have decreased thyroid hormones, can actually gain weight. This is typically due to a hereditary disorder called Hashimoto's. It is an autoimmune disorder, which means that the body erroneously considers parts of itself as foreign and causes the immune system to attack it as a result. So in Hashimoto's, the immune system attacks the thyroid gland and it decreases its hormone production. A few other symptoms besides weight gain include fatigue, constipation, depression, hair loss. Basically, everything slows down, and a simple blood test can rule this one out. Number 2, undiagnosed diabetes. Diabetics have something called insulin resistance, which is a topic that I've reviewed in some of my prior videos. Insulin's job, in a nutshell, is to get that glucose to enter the cell, but in diabetics, these receptors or doorways of sorts don't function properly, and therefore insulin cannot do its job. So because of this, the pancreas keeps pumping out more and more insulin to get that job done, and insulin causes weight gain. Therefore, uncontrolled diabetics tend to be overweight and gain weight more easily. Again, a simple blood test called a hemoglobin A1C can diagnose it. It will measure the amount of glucose circulating in your body for the last 3 months and is now used as a primary test for diagnosis of diabetes and prediabetes. We no longer do those nasty sweet drinks. If any of you have had that done before, they're pretty archaic. Number 3, PCOS or polycystic ovarian syndrome. It's another topic that I've covered prior, and I'll place the link in my description below. It's a hormonal imbalance that also causes insulin resistance, just like in diabetics. This hormonal imbalance also causes irregular periods and sometimes acne, hirsutism, that's excess facial or body hair, scalp hair thinning, and weight gain. Its treatment can be complex and may really vary depending on the patient, but weight loss is really key to its management. There are blood tests to help and support the diagnosis, but it is mostly a diagnosis based on symptoms and exam, meaning the blood test can be normal and the patient can still have PCOS. That happens a lot. Next, menopause. Estrogen levels decline in menopause, and this causes a shifting of hormones and subsequently our adipose tissue, which is just another fancy word for fatty tissue, which we all have to some extent. Women report weight gain quite commonly during menopause, and menopause is defined as 1 year without a period, and a blood test is really often unnecessary. Number 5, medications. Certain medications can cause weight gain as a side effect as well. So here are a few examples. Some antidepressants, hormonal contraceptives, some anti-seizure medications, antipsychotics used to treat bipolar disorder, schizophrenia, and sometimes severe anxiety and depression. Chronic steroids, no, not like the ones that make you look like Arnold, but a different type. Sorry, Arnold. It's used to treat autoimmune conditions like rheumatoid arthritis and lupus. Insulin and certain diabetes medications can also cause weight gain. If you're taking any of these medications and you're struggling with your weight, however, make sure to always discuss your medication list with your doctor before you decide to change or stop any treatment. I mean, that's just for your own safety. Number 6, pregnancy. I've seen this one before, more than once, I must say. Women who don't menstruate regularly, or those who are postpartum and breastfeeding and may not have regular periods return yet, will come in with weight gain complaints. They may not know that they're pregnant in the first trimester or possibly even the second semester, and may gain weight through this time. Number 7, stress. Now, I don't like to blame stress for every little thing, But there is a theory that cortisol levels rise during stress, and cortisol is a fat-storing hormone. Therefore, people experiencing great stress may possibly gain weight more easily or indirectly. And more commonly, they may be snacking or paying less attention to their nutrition and health and thereby gaining weight in this way. And lastly, snacking and liquids. I knew this one was coming. Well, staying home during this lockdown means easier access to food and more downtime to snack for all of us. But be careful, because snacking can pose as a great source of extra unnecessary calories, especially since most snacks are processed and high in carbohydrates. Think chips, breads, sweets, etc. Also be wary of any of your drinks with sugar. Sodas, juice, sweetened iced teas, Gatorade, coffee drinks, etc. They may contain unnecessary amount of carbs, and they can hide them in there and you will never know. Sometimes I see my patients losing weight just by simply discontinuing their liquids with sugar. Yes, opt for water with a squeeze of lemon or sparkling water. Whatever you select, read the food labels and make sure that it says 0 carbohydrates. Well, if you found this information valuable, which is always my goal, please give it a like and hit that red subscribe button along with that notification bell next to it so that you do not miss any of my future videos. And please feel free to share it with someone else who may find this useful. Stay healthy, and I'll catch you next time.